Malaria is a major public health concern in Nigeria, with an estimated 68 million cases and 194,000 malaria deaths in 2021 alone. Nigeria has the highest burden of malaria globally, bearing 27% of the global malaria burden. So it was great news when the country received the first batch of the R21 malaria vaccine from Gavi, the Vaccine Alliance. Is this the silver bullet? And will we see a drastic reduction in these malaria figures? How do we get the public to trust another vaccination drive? And what is the plan to tackle traditional beliefs regarding vaccines? Poor infrastructure, especially in rural areas, financial constraints, power supply issues, healthcare officials, and insecurity. My guest provides us some insight as we navigate the malaria vaccine drive in the nation's capital. This is Dateline Abuja. Hello and welcome to Dateline Abuja. I'm Kayla Megwa. What a busy week in the nation's capital. But just in case you missed some of it, let's keep you updated on our Abuja wrap.
President Joe Biden has called to thank President Bola Tinubu for the release of Tigran Gambaryan, an executive of Binance Holdings who had been on trial in Nigeria for money laundering and currency speculations. The Minister of Foreign Affairs, speaking with journalists in the State House, said the two leaders also discussed areas of partnership and cooperation, including the issues of security in Africa and in particular West Africa. Meanwhile, President Bola Tinubu launched the 2025 Armed Forces of Nigeria Remembrance Day emblem and appeal fund in the State House.
We take today to remember our fallen heroes who had sacrificed their lives, men and women, for the unity, stability, and progress of this country. I therefore take the opportunity to launch the emblem.
Also, President Bola Tinubu has been advised to withdraw the executive bills on tax reforms presently being considered by the National Assembly. This was one of the key resolutions passed during the National Economic Council meeting chaired by Vice President Kashim Shettima at the Presidential Villa, Abuja.
Council therefore recommend the need to withdraw the bill currently before the National Assembly on tax reforms so that we can have wider consultations and also build consensus around these reforms for the benefit of the entire country.
The Nigeria Governors Forum and the National Council of Traditional Rulers have resolved to take a common position on a constitution amendment bill seeking to properly structure the traditional institution in the country. Governor of Ogun State, Dapo Abiodun, briefing journalists after the two groups met, said a committee to be chaired by the Imo State Governor, Hope Uzodinma, is to compile a report for consideration. They also discussed local government autonomy, community police, and governance.
Various remarks and comments that were made from those that are here present should be included to make for a robust document. And memoranda should also be called for and received. And all that should be synthesized so that whatever document will be presented to the National Assembly will be a very comprehensive, a very inclusive document.
The federal government has appealed to state governments yet to comply with the new National Minimum Wage Act to begin doing so. Speaking after meeting with President Bola Tinubu, the Secretary to the Government of the Federation, Senator George Akume, applauded those states who have commenced paying workers.
We arrived at the new minimum wage. We're very satisfied with it. And some state governments have started implementing. Others have even gone beyond 70. So I believe that there's no problem with that whatsoever. We applaud those who have started. Those who have not started, we just want to appeal to them to start the payment.
The Minister of Power, Mr. Adebayo Adelabu, says the idea of a national grid is outdated and the country must translate to regional and state power grids. This is even as the country strives to achieve uninterrupted electricity supply. Speaking with State House correspondents after meeting with President Bola Tinubu, the minister also assured that the major transmission lines that were vandalized and affected supply to 17 states are on the verge of being fixed. He also spoke on efforts to install a 100-megawatt solar power source for each of the 20 northern states.
This is the 21st century, and we believe that the most effective way of supplying uninterrupted, functional, stable, and reliable electricity to the northern part of Nigeria is through our distributed power model, whereby each of the northern states will have an embedded utility solar scale solar source. All the 20 states will be insulated and immune from each other.
President Bola Tinubu has approved the sum of 10 billion naira for the Federal Capital Territory Youth Empowerment Fund. Speaking during the flag-off of construction of an access in Ushafa, Buhari Area Council of the nation's capital, the FCT Minister, Mr. Nyesom Wike, confirmed and also disclosed that his administration will soon launch an advanced security scheme to curb insecurity in the FCT.
This is the first time that Mr. President insisted there must be a youth development fund on how to help the youth to grow. And Mr. President provided, for a start, the sum of 10 billion naira to see how the youth can be empowered. On Friday, of course, we are going to launch another security scheme where we are going to make sure whether you call yourself that you are not the cause, it's not my business. Stay in your state and beg. Picking what say mama no go sleep, him go sleep. Him go sleep. So, criminals, we are ready.
Right here in the nation's capital on the 17th of October this year, Nigeria received the first batch of the 846,000 doses of the R21 malaria vaccine from Gavi, the Vaccine Alliance. The Minister of Health, Professor Ali Pate, while speaking at the official launch, says the receipt of the vaccine is a significant milestone in the transformative efforts of the health sector by the President Bola Tinubu administration in the fight to eliminate malaria in the country. According to Professor Pate, the distribution of the vaccines will be prioritized to states with the highest burden, beginning with Kebbi and Bayelsa states. Please watch this.
Thank you very much. This is a great day.
The Minister of Health and Social Welfare, Professor Ali Pate, flanked by development partners, are the National Strategic Cold Store of the National Primary Healthcare Agency for the official handover of the R21 malaria vaccine to Nigeria by Gavi, the Vaccine Alliance.
Thank you. Let's get on with it. Let's eliminate malaria.
We are at this moment at 5 degrees.
Here in the cold store lies 846,000 doses of the vaccine, and the minister takes a first-hand look.
Yeah, so we're waiting and looking at the outbreak.
The minister highlights the contribution of the vaccines to the government's efforts in the health sector and the fight to eliminate malaria in Nigeria. He also addressed concerns on the efficacy of the vaccines, insisting that it is safe for malaria prevention.
Under the leadership of the president, repositioned Nigerian health system, but also focus on the things that matter to Nigerians. And the miracle of vaccine is one of them, because it can prevent diseases from happening. But vaccines are also an opportunity, because for every child, every girl that gets HPV, it's an opportunity to live a life free of cervical cancer. Every child that has full course of malaria vaccines has an opportunity to live a life of health. A child that is immunized against measles has an opportunity to live a life free of that disease that could be very debilitating. I want to urge all well-meaning Nigerians to take advantage of the limited availability and the fact that these are valuable commodities and bring their words where they have the opportunity to make sure they are protected with these vaccines and to discount misinformation for uninformed people who sometimes have their own agendas or may not understand what they're talking about, to cloud people's minds and prevent them from receiving something that is of value to them. So the media has an important role to play, and Antimoji laid it out, just like Dr. Kazadi. We have to continue to emphasize. I also want to assure you that the traditional religious leaders have been with us on this path since the polio days, and they are still with us. We thank them, and we continue to interact with them in a very constructive way because they are custodians of our cultures, of our traditions, and they are respected by our population. The infrastructure that we have for delivering these vaccines can also help us if there is an emergency. Just as it helped us during cholera, during meningitis outbreaks, with diphtheria, with COVID-19, with Mpox. This infrastructure that we have, whether it's a cold store, the logistics, the trained health workers, the community mobilization, and the partnership that we have will ensure that we safeguard our population.
For the development partners, it is a big win for Nigeria. They pledge continued support to the fight to eliminate malaria in the country.
Very important that we convey the same message, whether the judiciary or the parliamentarian, the executive body or the government, the community societies. Vaccines are safe, and we are ready to work together to provide evidence that vaccines work and they are not there to harm our population.
That in the last 50 years, more than 154 million lives have been saved because of vaccines. And now we have a new vaccine right here in Nigeria. More than 846,000 doses are here today, that they are going to be used in 2 states to start. My appeal to the Honorable Coordinating Minister is to be ambitious. We know we can say it's an expensive vaccine, right? It means a lot of fiscal space is needed. But we are here partners and under your leadership to support that effort, right? Engaging private sectors, engaging partners like Gavi and others, we are here to fully support, and UNICEF commit that support. And what I hope is like one day, these vaccines are not imported, are not shipped to Nigeria, but they are actually produced in Nigeria.
The Director General of the National Primary Healthcare Development Agency, Dr. Muyi Aina, speaks on the deployment plans.
We have 826,000 doses. We expect another 140,000 or so to make 1 million doses in this first batch. Every child, every person that is vaccinated needs to get 2 doses. So we know that that's a limited number of people. So we have prioritized the highest burden locations in the country, Kebbi and Bayelsa. Now that we have officially taken custody, the team has already worked to develop a deployment plan in collaboration with our partners. And Nigerians can expect that, within the next couple of weeks, in those states, those 2 states where we're starting, you will start to have access to the vaccines. We're going to be communicating very widely what the specific strategies are, but also communicating very widely the locations that people can get vaccinated.
According to the 2022 World Malaria Report, 97% of Nigeria's population is at risk of catching malaria, and the country accounts for the highest percentage of the global malaria burden compared to any other country in the world, with 27% of the global estimated malaria cases and 31% of the estimated deaths due to malaria. Nigeria accounted for an estimated 55% of malaria cases in West Africa in 2022. The government of Nigeria secured credit facilities from the World Bank, the African Development Bank, and the Islamic Development Bank to the tune of $364 million to fund health sector interventions in the fight against malaria in 13 states. The arrival of the vaccines is an initiative by the World Health Organization to distribute malaria vaccines to high-burden countries across Africa, including Nigeria. This introduction is expected to significantly reduce malaria cases and deaths in the country. My guest on the program is the National Focal Person, Malaria Vaccine and Seasonal Malaria Chemo Prevention of the National Malaria Program, Federal Ministry of Health. How does the government plan to address issues such as poor accessibility, provider compliance, patient adherence, cultural factors, governance, and supply chain constraints as it begins its malaria vaccination drive? In the fight to end malaria in Nigeria, where are we now and where do we plan to be in a year? Dr. Shekarau Emmanuel, welcome to Dateline Abuja.
Yeah, thank you so much for having me.
You know, when we talk about vaccinations in this country, there's so many challenges that come to mind. Accessibility, especially in many rural areas, acceptability by the people, and then, you know, just a general hesitancy when it comes to vaccinations. And it's not peculiar to Nigeria. We see that happen a lot in parts of Africa. But let's talk a bit about this vaccination drive. R21 is here. Your hopes with the release of an actual vaccine for malaria?
The country carries the highest burden, which is not an enviable position for us as a program. And we have continued to put in all efforts to see how this can be brought down, and by deploying all available tools to bringing down the burden of malaria in the country. And one of those, the newer intervention that is about to be set out is the malaria vaccine. So we are hopeful that it will certainly go a long way in bringing down the burden of malaria in the country.
By how many percent?
Well, you know, the vaccines, like I want to point out and state categorically, even as pronounced by the World Health Organization, should not be deployed as a standalone intervention. Okay. It has to go alongside other tools that we currently have, preventive interventions such as the use of insecticide-treated nets and seasonal malaria chemo prevention, where we give medicines to children under the age of 5 who are most vulnerable, then protecting pregnant women using nets and also intermittent preventive treatment.
Together.
So it has to work together. Because, of course, the efficacy, like you must have read, it's not like 100%. And so the need to have it deployed with all other existent interventions that the country currently deploys. That's why I told you we're starting with the highest burden states like in the country, Kebbi State and Bayelsa State, because Kebbi, for example, has the highest burden of 49% prevalence in the country and contributing significantly to this burden of the malaria in the country. We are very hopeful that it is going to be well accepted, just like every other malaria interventions that we currently have. For example, the seasonal malaria chemo prevention that focuses on children under 5. You will see that when we go to communities, even it's meant for children under 5, but even adults begin to ask us, can we have some of these medicines? Because we can see our children are no longer coming down with fever or malaria. And even the healthcare providers are also saying they don't see children really coming there. So everybody is excited. So for malaria vaccine too, we believe, and like practically every time I get to be asked, anytime I even face the press for any interview, we tend to hear, when are we seeing the vaccines? So you would realize...
That was actually our next question. You said, but you had mentioned next year.
No, this year we're starting with Kebbi. Anytime from now, November, and Bayelsa State.
But the entire rollout will be next year.
Yeah, the entire rollout, even for next year, like I mentioned, from our plan, like I told you, it's a phased approach we're going to be deploying. We're going to be having phase 1, which is with Kebbi and Bayelsa State, starting from November. That's next month. And you know, the vaccine is 4 doses. So it spans for up to like 18 months, for example. Starting with children that are aged from 5 years, they receive 3 doses, 5 months, 6 months, and 7 months. And the booster dose is expected at about 15 or 18 months of age for children under 5. And to state also categorically that it's for children of immunizable age, because sometimes adults are excited about it. But yes, because we focus intervention on those that are most vulnerable and are likely to die. Some of those staggering figures you see from World Health Organization are principally from, you know, children under 5 who are most vulnerable and are likely to die from this disease.
So R21 doesn't work on adults?
Well, it's not meant for adults. Yeah.
Adults from what age?
It's not meant to, it's just for children of immunizable age.
Okay.
Yeah.
It is.
Yeah, because we're following
hopeful that one
routine,
will come to cater to us.
So, but for adults, if you permit me to talk about how malaria infection plays out, for adults, we are not too worried about adults in that what oftentimes people call malaria is actually not malaria. Because malaria symptoms and signs are non-specific. Fever is not specific to only malaria. Headache is not only specific to malaria. And joint pains and all other things that you feel when you have malaria is not only specific. In fact, we just came out of COVID-19 pandemic. The symptoms and signs of COVID are exactly the same as that of malaria. Symptoms and signs of flu, this normal catarrh that we have every now and then, they are clearly the same with that of malaria. So the only way you can distinguish the fever from malaria and other diseases is by testing. And that test is what people don't do. Once they feel these symptoms, they just walk into pharmacies and buy anti-malaria, which is totally wrong. Because in adults, you barely come down with malaria once or twice a year. And you have what we call a partial immunity because of the repeated exposure you have had when you were growing up. And once you are above that age of 5, once the immune system is well built, at that point, you can easily fight it, but not in totality. That's why it's called partial. Unlike some infections, when you have them once, you develop a total immunity to it, like chickenpox, like, measles and all of that. So malaria, you would have memory cells that can easily tell, okay, this is, and it will help in reducing you from coming down, or even when you come down with it, you are most likely not going to die from it. We are not where we want to be, but we are also making a lot of progress.
Because even at 22%, it's still one of the highest in the world.
Yeah, absolutely. It's still one of the highest in the world. And you will know that one of the challenges we have, of course, the populace and the utilization of the intervention is still also not encouraging. For example, we have shared millions of insecticide-treated net, which is one of the best interventions at preventing malaria in any country, all right? But many times when we share this thing, people don't use them. We go around, we share free malaria medicines, all public health facilities practically across the whole country. We have diagnostic and treatment medicines, but people don't even oftentimes patronize to use those interventions. So the government is doing a lot, and we are also making a lot of progress, especially under this current dispensation, under the Honorable Minister of Health, the Coordinating Minister of Health, who is also particularly concerned and had convened the whole world to come to Nigeria to deliberate on the malaria burden. That's called the rethinking malaria concept. And as we speak, a lot of efforts are also being put in place, one of which is the introduction of the vaccine that we're going to be having just very soon in the country. So a lot of things are being put in place. And what we will want to call on people is to ensure they utilize these interventions. Not when you collect these malaria nets, you look for the nearest pharmacy and sell it, and not use it, or keep it, or use it to fence your farms. All those ones are the challenges that we mainly have with the and not like we are not doing what we're supposed to do.
Well, I wish you all the best. It's a lot of work you have ahead of you, and I hope you're able to achieve all that it is that you've set for yourselves in your office. Thank you again for being with us on Dateline Abuja.
Thank you so much. Thank you.
Thanks to my guest and to everyone who spoke to us today on the program. Let's hear your thoughts on the malaria vaccine drive in Nigeria, bearing in mind the burden we bear as a people in terms of infection rates and deaths as a result of a disease we are now told can be prevented with this vaccine. Speak to us using the social media platform showing right now on your screens. Thank you so much for watching. I'm Kayla Magwa. See you next time.